Helen Redman toward a U.S. harm reduction strategy, one story at a time. This is about tobacco use harm reduction. Published in SNAS Format, September 22, 2022. In this installment of our Harm Reduction Heroes series, SNUSFOMET talks with Helen Redman, a social worker, journalist, and passionate champion of safer nicotine products, especially for the most vulnerable in society. Primarily an expert in substance use, Helen Redman also boasts an impressive background in harm reduction. For more than 2 decades, she's worked as a licensed clinical social worker, providing support to people who use drugs and live in harm reduction-based housing. She also provides training and consultation on mental health and nicotine use, and in 2016 organized the first tobacco harm reduction conference in the U.S. I had kind of a light bulb moment in 2013 when a German friend brought back some vaping products from Germany. Around 90% of the people in our harm reduction housing were smokers, and I suddenly realized that they were not addressing smoking. They had stopped or dramatically cut down using heroin, and they cut down on alcohol, but they were all still smoking. A matter of life and death. A problem was that already given up their drug of choice, they weren't keen on giving up nicotine. Sadly, most of the people in Helen's harm reduction housing program suffered from anxiety, depression, schizophrenia, and were bipolar. Due in large part to smoking-related illnesses, these people with these conditions die an average 25 years earlier compared to the general public, according to a 2017 study by researchers at Stanford University. How to reduce the harm of tobacco use was and is literally a matter of life and death. They had kicked all the other drugs, and they were like, well, I've given up all these other drugs, so let me have my cigarettes. Please leave me alone. It's legal, so I'm not going to end up incarcerated, and I enjoy it. And that's kind of powerful, right? She explains. But it's the smoking that ends up killing people. It's combustible tobacco. More so than heroin or alcohol, it's the cigarettes. So we started to provide smokers with vaping products, and that's how it all started with me in tobacco harm reduction. Engaging U.S. public health officials. From there, Helen helped organize a tobacco harm reduction conference in Brooklyn in 2016. It was the first time a conference specifically addressing smoking among people with a psychiatric diagnosis had been organized in the United States. The conference brought together harm reduction experts from around the world. And even more significant for Helen was the attendance of representatives from the New York City Department of Health and Mental Hygiene. When we started out on this, we knew right away we had to work to try to convince people in public health to get on board with tobacco harm reduction, explains Helen. Without that support, meaningful progress is difficult. However, attracting sustained and significant support from the public health authorities has proven difficult. As with their ongoing so-called war on drugs, nuanced thinking on addiction and harm reduction issues is rare when debate in the public arena is often driven by ideology. Helen Redman, abstinence will not work. The United States authorities just preach abstinence on most drug or addiction-related issues, says Helen Redman. The evidence has been in for decades. Abstinence will not work for most people, and why should it? There are millions of us who medicate. There are people who take high blood pressure medication every day. People who take insulin. I have to inject myself once a week. But when it comes to nicotine, users are often told that they must stop. For millions of users, nicotine delivered in safe products such as e-cigarettes, snuffs, tobacco pouches, and gum make their life better. So why should they have to practice abstinence? Snuffs and the nicotine pouches, Helen feels, are somewhat underappreciated in the United States as harm reduction nicotine alternatives. Even if the U.S. sales of nicotine pouches in particular are booming. According to figures from the U.S. Centers for Disease Control and Prevention, CDC, sales of nicotine pouches grew 300 times larger during the first 5 years since pouches became available in the U.S. market in 2016. Other figures from Stockholm-based snuff manufacturer Swedish Match shows that sales of Zyn nicotine pouches up from 150 million cans sold in 2020 up to 300 million cans in 2021. I think it's so great that they're available for people, she says. This is how sad it is, actually. I'm aware of the studies that found this stunning drop in the rates of smoking in Sweden. These products work for millions of people who enjoy nicotine, and they're very discreet. You can use them in situations where vaping products might not be possible, for example, if you're on a plane or some kind of transportation network system. Snuffs and the patches are great products, although I think they could be used more in the United States. A national harm reduction strategy. The ultimate goal of Helen and other harm reduction advocates in the United States is the creation of a national tobacco harm reduction strategy. Helen believes that snuffs and nicotine products could play an integral role in such a strategy, with safer nicotine products being offered to groups with the highest rates of smoking and thus the highest rates of morbidity and mortality. Approximately 480,000 people die every year in the United States from smoking-related illness. We know who they are, we know where they are, and so that means we have a mobile nicotine van that goes into neighborhoods that have the highest rates of smoking. And we need to offer them an array of safer nicotine products. That's e-cigarettes, snuffs, nicotine products, and nicotine gum. Anything basically that stops them from burning the tobacco. Humanizing vulnerable groups through storytelling. In addition to her career as a social worker, Helen has in recent years served as a journalist and senior editor with Filter Magazine, an online magazine founded in 2018 that advocates for rational approaches to drug use and harm reduction and a more compassionate U.S. drugs policy. Helen is passionate about the importance of storytelling and believes her stories for Filter help put a human face on harm reduction by offering real-life tales of drug and nicotine users and their endeavors to live less dangerous lives. People who smoke are stigmatized and left out of the national conversation, she says. Helen Redmond believes the new goal of the public health authorities is to demonize and stigmatize people who use cigarettes, even though these devices are much safer than conventional cigarettes and will save countless lives. So, in combat this vilification, what I try to do in my work is to tell the stories of the most vulnerable groups of smokers, to humanize them so that people know that they exist and that they are real people. My storytelling is about the real struggles people have with smoking and about how, with the intervention of safer nicotine products, we're in a world now where we can actually help people make that transition from burning tobacco, and also tell the stories of the most amazing people who have done it. These are the voices that I want to amplify because right now they're being totally ignored.